All right. Hi, everyone. Hi, Dolphins. Thank you for joining us for another episode of Pod Talks. My name is Jay Castellanos. I am a career counselor for CSUCI. And today I'm very excited to introduce our guest. She is a 2010 graduate from CSUCI. She studied psychology. And she is an avid cyclist. She likes to go on hikes with her dog, and she likes to take photographs and pictures, and she is currently a PA. And let us please welcome to the show Diana Gutierrez. Thank you, Diana, for joining us.
Thank you, Jake. Thank you so much for having me. I feel really honored that you invited me to be on this podcast.
Absolutely, absolutely. Yeah, thank you for being here. So first off, Diana, I just want to check in with you. How are you staying safe and well during these times?
Yeah, thanks for asking. Well, I think like a lot of people right now, we're kind of forced to make adjustments to our daily life. And so, being a healthcare provider, I have to kind of take some extra. So, in addition to social distancing and to, trying to limit my exposure to people, other than work. Every day I show up to work, I have my mask on. I'm always sanitizing, infecting rooms. I'm always just making sure that everything that I'm doing is not just for my protection, but for the protection of others. So, unfortunately, it's meant that the holidays aren't the same. You don't get to see your friends as often, and you don't get to travel. But that it's all for the greater cause, and it's all for our own well-being. So, I've made a lot of adjustments, but I've also learned to connect more with people, kind of like how you and I are right now. Um, Virtually, nice too.
Absolutely. Yeah, that all sounds great. And being patient with it all too, right?
Right. Yeah, it requires a lot of patience because, it's interesting. I think in my field, the in being in healthcare, we have really limited in our practice, we've limited the amount of patients that we see and we've spaced them out. But, we still see patients. Medicine doesn't stop. So it's an essential business, I guess, if you call it that. But it just talking to a lot of people, I know that the frustrations have, there's some people that it's really tested their patience, and some whom it's tested so much that they have just given up. And they say, I'm just going to live my life. I'm going to go out. I'm going to travel. I'm going to do all these things because I can't take. So I find that everybody's patience is being tested with this current pandemic. And at this point in the pandemic, I just try to stay encouraging to people. And now that the vaccines are rolling out, there's a push to tell people to try to hang in there just a little bit longer. Because we will get through this, but it's it's tough. And mental health, is really important. So it's hard sometimes to, when I'm talking to people and they feel like they have become more depressed or more anxious or more isolated from friends and family. And that's their biggest reason why they've given up on trying to adhere to the guidelines. So, I just always try to be patient and try people to be patient. I think we're going to get through this. It's really unfortunate, everything that's happened up to this point, but there's hope.
Yes, there is. And thank you for sharing that. Yeah, it does take all of us and patience together,
Yeah.
one step at a time. Um, Diana,
Right.
for individuals searching and looking for work right now, what are some pieces of advice that you would give them?
Yeah. So, a consequence of the pandemic is that a lot of people have lost their jobs, right? Um, a lot of people are struggling to find a job. And so what I would say is, you know, have I would tell people join the virtual conversation. You know, this pandemic has really forced a lot of us to change how we approach looking for a job, how we approach networking, So I would familiar with these these social media platforms and learn to utilize all of that they have to offer. I think, a platform like LinkedIn is excellent because it you're able to update your resume, you're able to, follow people. You're in a specific career path and you're thinking that you want to make a change or you want to go up in your current position. There's a lot of people within the same industry on LinkedIn. You can look at their resumes, you can reach out to them, connect with them, you see how they did it, and you could try to go about it that way. Or there's resources within LinkedIn. So, there's the LinkedIn, like the education portion of it. There's a ton of modules, a ton of courses that you can take. Let's say you're a new grad and you're having a hard time finding your first job. Well, you can go on LinkedIn and go through these courses that teach you, how to set goals, how to plan for your career. And, you can use your time to really map out how you want your future to look like. So, it just I think that the world around us is changing, and how we do business, how we connect with each other is changing. So it's really important that we are able to adapt to the change that's going on around us. So, there's a lot of excellent courses online on how to prepare for a virtual interview. That's a big deal. That's your first impression. It's not in the traditional sense where you go to the office of the employer, you meet them and sit down with them. That's not happening as much anymore. So, your office space is where you have your interviews. So making sure that you set your space up, making sure that you have the proper equipment, really get up to date, stay up on the technology. I think that is going to make a big difference. Um, and then I also kind of think that if you look at your own this is a good time for people to look at like their social media pages, right? Because employers are looking at they're not able to meet you face to face, so they're looking at your profiles. So just being mindful of what you put out there, and and really trying to encompass, put forward a positive image, and just be mindful that this is your first impression on an employer. So you want to it's a good opportunity to just really kind of like look into what you're doing online and what programs you're involved in, what activities you're involved in. It, I think that there have come a lot of positives from not, well, I don't know, it sounds weird, but from the pandemic, I think that people now have the option to work from home. A lot of employers are really getting behind that. And a lot of people prefer to work from home too. So, there are some positives in all of this. And I think just learning how to navigate, how to adjust to that is going to be key. For
That's
sure.
great. Great advice. Thank you. And I really like how you mentioned, the LinkedIn learning modules
Yeah.
and getting on those, because once you complete one of those, you can put that right on your profile and have anyone see that, which is really cool.
Right.
But yeah, great
Right.
great sound advice to stay up to date with the virtual skills, and those are more than necessary nowadays, for majority of works. So
Right.
thank you. Now, shifting more to kind of your work and your realm of industry experience, are there any trends that you've noticed in the healthcare industry? And then more specifically, are there any specific advice you have for getting hired in that industry?
hmm Yeah. So, you know, when I, you know, when I was going through my education is doing your rotations, your clinical rotations. So you rotate about 6 weeks in one area. So you can rotate in emergency medicine. And then the next 6 weeks, you're in family medicine, internal medicine, and so on. While you are in your clinical rotations, and even when you're in the classroom or now a virtual classroom, it's important for you to always network and stay connected to the people that you meet in these rotations, because you never know when they may turn around and help you get to a certain level of your career. You know, I did my PA education on the East Coast. So, but I did a rotation in Santa Barbara. I did my emergency medicine rotation at Cottage in Santa Barbara. I was able to get into the rotation at Cottage because of some I was working out here before moving to the East Coast. And then when I lived on the East Coast and moved back to Santa Barbara, it was somebody that I met in the emergency department that was able to help me get my job. So it always, it's all about who you know, to always, you know, especially in medicine, it's very, you're surrounded by so many intelligent people and very competitive people. So it's important for you to, you know, do your best, but also make an effort to get to know the people around you and to get to know your mentors and the attendings, and ask all the questions that you can, because I think that, you know, they are often going to be the people that help you get into the position that you want to be. Now, to answer your questions about trends in the industry, there's so much going on right now. It's really exciting. I think now, you know, now with the whole, a lot of our consultations and visits are happening via telemedicine, um, uh, virtual meetings. It's not just it's not just the conversion to telemedicine health that I've noticed, but it's just in general our approach and our acceptance of technology to help guide our healthcare. So, you know, there's a lot of stuff that's done in hospitals right now. Um, you know, monitoring their vital signs and, you know, monitoring for alarming symptoms. Is the patient decompensating? Well, now a lot of technology can happen in the comfort of your home with certain sensors and um, certain sensors that are collecting. So now with the use of AI to interpret all the data that we're collecting, you know, there's going to be a lot of shift and a lot of growth happening within that sector. You know, the other day I was reading an article that was titled "How Your Smartphone Can Detect You Have COVID," and I thought that was really interesting. So I started reading the article, and essentially, you know, now we have heart rate monitors. We have, you know, monitors that track our oxygen saturation, our temperature. And so all of this data gets converted into your smartphone, and it can send you an alert, and it will say, you know, Diana, you know, you should go to the emergency department, or you should quarantine, or you should just, it gives you sort of a nudge. Um, and so I think there's a lot of, and I thought that was really, you know, interesting, because it's true, you know, just with the advances in technology, it's going to really sort of revolutionize medicine, the future of medicine. And it's just going to be about working, being able to work within these, all the data that's collected and working within these systems. So those, I would say those are the most, those are the most dramatic advances I think I've seen in the healthcare industry, even within my specialty. So I work in plastic surgery, and it's cosmetic and reconstructive plastic surgery. But within the umbrella action, we deal with wounds, right? Traumatic wounds, pressure wounds, diabetic wounds. And there's framework now that are, for smart, um, like bandages, smart wound bandages. So it can detect, is the wound, is it getting worse? There's just a lot of change happening with the way that we provide care because of technology. So I think that I think that's one of the biggest things that I've noticed.
Yeah, that's great. And it goes back to an earlier point you made, right, about staying up to date with technology.
Mhm.
So you're seeing this current trend. It's
Yeah.
however more important for individuals who want to be low in the healthcare system, um,
Mhm.
to also stay up to date with those technologies that are now becoming more and more used.
Right.
Really, really interesting. Um,
Even like with COVID, the vaccination, so much is so much changes from we collect more data, we learn more about this novel virus. And you know, the more we know, the more we're better able to provide care. And it's just, as a provider, you always have to stay up to date. And you're always going to want to, you know, be reading about the changes because, it's happening,
Absolutely.
so up to date.
Yeah,
Mhm.
that's great advice. And I I think for anyone, thinking, planning ahead, maybe joining a professional association where you can get, articles and research that's current and get up to date information
Right.
that you can read from time to time, or joining a club that can, provide that information as well. As a student, you get student discount rates for different organizations. So
Oh, great.
just making a plug for that for those of you listening. But
Yeah, I remember a couple of sometime last year before COVID. I thought it was really exciting because there's a group at Channel Islands now, a physician assistant group. Um, and I went out once to do a suture workshop just to kind of show techniques or teach about suturing. And I thought it was so neat. There were about 20 people in the class, and you're to go to PA school. And I thought, this is so great. When I was at Channel Islands, there wasn't a group like that. So it's nice that, the campus is growing, more students are getting involved, and now there's actually, somewhere that they can go. They have a hub, they have a connect, can help each other out.
that's awesome. That's a really cool experience that you were able to come back and do that for uh, the club
Yeah, it was really, really nice. It was nice. It's nice to meet like all the students that are eager to become physician assistants. It's
that's
a
awesome.
great.
Speaking about PA school, if you're talking to someone who's wanting to apply to PA school, what is the best advice that you would give them?
I would say that um, somebody that's wanting to apply to PA school is, just go for it. Sometimes when I talk to a lot of uh, students, they're always a little bit hesitant because of maybe the clinical hours or not fulfilling the prerequisites and setting certain timeframes for yourself. Certain students are afraid that, you know, they don't go to PA school or to med school. I would say just fulfill your prerequisites talk to people, get to know physician assistants in your area, talk to other students, get to know medical doctors, get their experience. You'll know, being a medical doctor and a physician assistant are two completely different career paths. So, first solidify which is the one you want to do, because that's probably by far the most common uh, question I get is, should I go to PA school? Should I go to med school? And then so and then once you have an idea, then just go for it. Fulfill your prerequisites, try to get involved, volunteer, um, reach out to people in your community, try to start a project. There's a lot of volunteer projects. I mean, I'm not exactly sure because of COVID, but I know that in Santa Barbara, I believe the Santa Barbara street medicine volunteer program is still going on, where they provide care to homeless people. So, I think the more you get involved, the more you'll know if the PA path is right for you. And then just don't get discouraged. You'll be surprised how many times people um, how many times people have to reapply. It's not unusual to get completely rejected your first time or your second time or your third time. I went to school with one of my good friends. It was her fourth time applying before she got in. So, if being a physician assistant is really a calling for you, don't give up on it. One of my best friends just got into um, PA school in Utah, and she's been trying to reapply and trekking forward for about like 6 years now. And she's finally got in, so your time will come, and you know, there will be opportunities. So just don't give up, keep, don't stop learning, always stay up to date, be get excited about your career. And I think that it will show. It will show when you get that interview and you get that opportunity to talk to um, the program directors. The hardest part is getting the interview, but once you get the interview and you let your personality shine through, you'll get in. So if you can get the interview, that's the hardest part.
It's awesome. Thank you.
Mm-hmm.
Well put. Well said. And now thinking kind of more along the lines in terms of, your career and generally speaking, what's the best advice that you've received in terms of that's helped you navigate your career? What was it, and how have you used it?
Yeah. So in my career, specifically, um, you know, it can be a very intimidating environment, especially as a new graduate, where you start your job and you're just thinking, oh my gosh, I'm supposed to care for people. Like you take on that responsibility and you start, questioning, like, am I good enough for this? Am I smart enough for this? Am I going to know how to manage this patient? This is somebody's family member. And I think this advice that I got once I started my career was just, you're not alone. We are a team. So, don't assume the responsibility 100%. There are nurses, there are medical assistants, there are scribes. This is a team. So, and there are people that have been here before you. There's people that are going to be here after you. So you do your best in managing the patient, and your team, if there's something that is questionable, your team will be there to support you. We're all going for the same, uh, we all want the same outcome. So that was really helpful for me as a new grad entering my career, because you're afraid. It's a you're caught. It's a for me, it was a bit of anxiety, and because you don't want to mess up, you want to do the right thing for the patient. So feeling that reassurance that we're all a team was very helpful, and for me it helped sort of push my confidence to another level. Like, okay, you become confident in your decision making, and you, as long as you're able to justify your actions, and most importantly, what I was told is, as long as you know what not to do, you know that's and I hope, like, if anybody watches this, when you become a PA or a doctor, as long as you know what not to do, don't do that. And everything else, it will you'll figure it out. So I think that you know that's really, really helped me, and help just working on my clinical skills.
That's awesome. Thank you, Diana. I
Yeah.
appreciate you sharing all that. And um, thinking about how you've stayed connected, right, and to the CSUCI community. What does the community mean to you, and how are you staying connected during these times?
Yeah. So for me, the CSUCI community is, what it means to me is basically that it's a community, it's inclusive, it's opportunity. So, I'm a first generation student, first in her family to go to college, graduate college. So for me, it changed the trajectory of my life. So, you know, I feel really, I have a very special place in my heart for CSUCI, and the professors, the community that I met while I was there was very understanding of the situations. Um, all of the professors that I met, that I came across, were always willing to help. There was always resources available to help me. I don't know, it was just a great place. That's why I wanted to return and somehow pay it forward. Especially after learning some of the statistics, as far as, you know, being ranked 20 out of, I think, over 1,400 universities for having for basically helping people change the outcome of their life and putting them into good careers, especially like helping disadvantaged students. So I thought, this university is doing really, really good things. I was reading a statistic about the percentage of first generation students, and it's over 50% of the students at Channel Islands that are first generation, and that's big. That's a big deal. That you know. So the way that I try to stay involved is, I joined the alumni, the board of the Alumni Association, and that's a group where we meet quarterly and just kind of discuss ways to stay engaged within the community. And recently, I joined the cohort of the Santa Barbara chapter of that, and we just had our first meeting. So, it was a very positive meeting, a lot of really good ideas on just how to make our presence known in the community of, Santa Barbara, Ventura County, and just so that we can kind of get the word out there, and try to help connect students into good positions.
That's awesome. Thank
Yeah.
you. And how meaningful and powerful that was, and I can only imagine for you, to be able to give back to the community that was able to give you, those opportunities too. So very,
Yeah.
very cool. And um, I have my last question for you, Diana, today, and I will just ask: do you have any last words of inspiration or motivation for whoever has joined us today?
Yeah. I mean, I think maybe, the last words of motivation is, um, this is a rough time that we're all kind of going through. So, you know, stay hopeful and work hard, because working hard is never going to go out of style. So whether we are virtually learning and getting our education, or virtually working, or working, you know, at an office, that never is going to change. So work hard and always stay eager, and find ways to remind yourself of your passion and why you're doing what you're doing. And never forget that, what you do and how you treat somebody can change their life. So much of, who I am and the things that motivate me and that got me to where I am are because of the people that helped me along the way, or that I've met along the way. So just remember that, and just know that, that there's always going to be a way to help somebody, and do your best to do that. And
I like that. Thank you. That's great. And what powerful and positive advice that is, and to give back, and how that can be so giving in its own way.
yeah,
Power of giving is really truly truly amazing. So thank you for your words. Thank you for your advice. Thank you for your time today, Diana. I very much appreciate it, and I hope that you continue to stay safe and well. Okay.
thank you. You too. Thank you so much for the opportunity. Okay.